So my name is Ingrid Regine. I'm the CIO of UNAIDS. So as Dasha just said, and some have heard or not, we are working on actual applications also in this space. But what we're talking about today is the use of AI for ending AIDS and a study we did, a scoping study with the objectives to understand what AI solutions are available for HIV/AIDS prevention and treatment by looking at the existing literature and seeing the impact and effectiveness of AI and to document best practices and lessons learned by doing key informant interviews and then provide recommendations. So this was done by HERD, and that's from the University of KwaZulu-Natal. So the scoping study had, they looked at quite a large number of studies and documents, and 182 were actually included because they included really AIDS and AI, and yeah, mostly it was original research and some other reviews and commentaries, mostly coming from the US and China, and very little from other parts of the world. Mostly around machine learning, because these are actually completed studies, and as machine learning and as generative AI is relatively new, it's sort of a logical split. And then it's the study focused primarily on prevention and HIV treatment, but also we did look at health financing, epidemiology. I can never say that word. Well, it's very important in our field. So epidemiology. So that was the study. The scope of the study, and the results is that there is no real evidence that AI has a large impact on HIV-related outcomes, but the studies and also the interviews showed clearly a positive potential for AI to improve health outcomes, reduce costs, but also access and satisfaction of HIV services. Though it touched upon risks like bias, lack of data, the digital divide, and the difference between the countries, and also the capacity in the different governments on AI. It didn't really touch upon the human rights issues and equity concerns, and also the community and civil society input. So that's an area where we want to look more closely at, as it's key to our field. So I'd like to share two case studies. One is a chatbot in Brazil aimed at transgender women, actually, and also adolescent men who have sex with men, for PrEP demand creation. So the chatbot provides information in different ways, but it also identifies which of the key populations are at risk for HIV infections, and tries to create appointment scheduling and make sure that they participate in PrEP, and also remind, once they are on PrEP, to remind them and to have this adherence. It also offers self-tests. And the outcome of this, because this was also a study, is that it actually helped reduce some deficits in PrEP usage, also created sort of new or enticed new people to come on board and use PrEP. But it wasn't as high as sort of the take up as in other demand creation strategies based on social networks. So there was but it's a good example, and there are multiple examples of chatbots that really help either adherence or provide information, or allow this interaction with health workers. So a completely different type of AI application is the size estimation of populations. In this case, it was for as part of a larger project, a DREAMS project that really looked at improving the life or the AIDS-free future for girls and women in 10 African countries. This was done specifically in Uganda, looking at young girls and women and how to assess how much of these are at risk. So they use the general population data points as well as the ones that are already positive, and then use different models to estimate the risk of them being affected and how much they were at risk. And so this cost much less resources to do, and is also much more precise, and therefore the targeting of these women and girls in the programs was could be done more precisely. So what we want to do now is to continue sort of more to understand these gaps better, especially from the community perspective, and also enhance consultations with global networks to understand these issues relating to human rights, equity, and community leadership. We really want to look at this from an opportunity perspective. How can we really help it stop AIDS, and on the other hand, make sure that we include human rights and community leadership. So for this, we're collaborating with the Global Initiative on AI for Health, with WHO. We're working on a publication and want to work with more people, in conferences or otherwise, to develop briefs and technical guidelines on this, and really sort of see how we can move this forward.